Next, we've got three presenters from Shared Lives. So I'd like you to welcome to the stage Alex Fox, Andy Cook, and James Rossborough.
Thank you. There'll be plenty of people here who have never heard of Shared Lives. So I'm going to tell you a little bit about the model. Andy and James are going to tell you about what it's like to live in a Shared Lives arrangement, and I'm going to say something about the ambition we have for Shared Lives and GM. So there is a Shared Lives scheme in every GM area. There's actually one in almost every area of the UK, supporting about 14,000 people. So each of the Greater Manchester schemes recruits people who come from all kinds of walks of life, and they put them through a really rigorous approval process lasting several months. And then they match them with a local adult who needs support. So the people who use Shared Lives, people with learning disabilities, mental ill health, older people with dementia, younger people in transition, a whole range of groups of adults who need support. And once a good match is found, they share family and community life. So about half the people using Shared Lives live with their Shared Life carer. They move in with their chosen Shared Life carer once a good match has been found and live as part of the family. And if you go and visit a Shared Lives household, it doesn't feel like a service. It just feels like somebody's home because that's what it is. The other half visit their Shared Life carer regularly for short breaks or day support rather than visiting a day centre or getting a respite break in a care home. Either way, it's about real relationships and real lives, but it has the backup of a CQC regulated service locally, as well as us as the national body at Shared Lives Plus, and lots of infrastructure and all the policies and procedures, but that's kept in the background. It's there for when it's needed, but day to day, people enjoy living their lives as we'd all want to do. That doesn't mean that it's not safe or that it sacrifices quality. CQC actually says it's the safest and highest performing model of all regulated adult social care. So the work we're doing in GM started with conversations with people here, people who use Shared Lives, other people who might want to, self-advocacy organisations about what people want and don't want from this model. We don't think it's for everybody, but we think everybody should be offered this as a choice, and the infrastructure is there to do that. You won't be able to read these slides or circulate them, but what this is showing is that there are about 700 people using Shared Lives in GM already, but huge variation from each of the 10 areas. None of the areas are using it for a huge number of people. So Tameside is using it for 8% of people with learning disabilities. There are other areas that are showing that we could reach many more people than that. So we've been starting to do some work on what a scale-up plan could look like, depending on what ambition you want to have for this model. We know how to scale Shared Lives up. We've seen it happen in lots of areas. And if we wanted to equal Lancashire, for instance, which is one of the biggest schemes, that would be about reaching 185 more people on top of that 700 with Shared Lives. That creates a significant saving because Shared Lives is lower cost than other models. But really, if you talk to Shared Life carers, it's about people having good lives. So we started to think through some of the ways in which we'd reach that target. So obviously recruiting more Shared Life carers is a big part of that. There are currently 550. We might want to recruit up to 350 more if we wanted to reach 20% of the learning disability population. That's achievable. We know those people are out there. Like many of you, they don't even know that this model exists and it could be a career choice. We have examples of programmes that have scaled up Shared Lives successfully. So this was a Cabinet Office funded 12-month programme, and in that short period of time, working with a number of schemes around the country, 100 more people use Shared Lives as a mental health service. There's actually now an acute mental health service run by an NHS trust using the model. And we have a partnership with NHS England worth about £2.5 million, including working with Bolton CCG, that is developing this as a healthcare model for things like stroke rehabilitation, intermediate care, getting people with learning disabilities out of institutions. So as you can tell, and as you'll hear in a moment, we're all pretty enthusiastic about this model. And we also support a model called Home Share at Shared Lives Plus. But really, this isn't just about offering this particular model to many more people. It's actually about changing the way we think about health and care. So Shared Lives is part of a growing movement of what we describe as asset-based approaches which don't just think about what people can't do and what their problems are, but which also look for what they can do or could do with a little bit of help. And those are models which all focus which focus a lot on people's relationships, because actually it's in our relationships with our friends, our family, our neighbours, our communities. That's where we get our health and our well-being from, and that's where we keep it, where we stay strong as well. So for us, it's about offering this model in partnership with you and the local schemes to many more people, but it's actually about saying, shouldn't this kind of model be at the heart of what we do? So I'm going to hand over to James and Andy next.
Hello, I am James. I am 46 years old. I moved from Buckinghamshire to live in Shared Lives in 2010. I live in my own 2-bedroom house in Ware, Hertfordshire. I do voluntary work every Friday at the Ware Country Market, serving tea and coffee. I really enjoy doing it because I meet people and make new friends. I used to work in the guidepost shop, but I stopped doing it because I wasn't very interested in it. I work with the Shared Lives Plus, giving presentations and interviewing people who live in shared lives. I have been working in Buckingham and will be in Durham and Abingdon later this month. I do my own shopping and use the buses, and I enjoy making cakes, and I go to my favourite cafe called Truly Scrumptious in the town, and my pub fairly close to my house. And I like playing golf, bird watching, and I have joined the karate club, and I am just working on my orange belt. And I have been selling vegetables that I have grown in my garden and selling it at the country market as well. I like the freedom I have now because I can get out when I want to and have made lots of friends. My health is much better. I have a home feel, and I feel part of a family, and am now able to do more things myself, and that makes me happy. Yeah.
Thank you. As always, James, very, very well done. Very, very briefly, you'll have picked up from the model that James has actually moved the model on. We've moved the model on. In fact, we managed to put... James now lives in his own house, his own very own house, and very, very close to mine, I hasten to add. He came, as you may have picked up too, he was all his life until 6 years ago in specialist residential care. And now he's doing all those things. Those are the things that are important to him. Those are the things that matter to him. And as far as I can see, those are the things that make him well. I concentrate on his strengths, on what he's good at, and what he likes doing. A few years ago, I talked to James and said, what do you want to do? He said, I'd like more friends and a paid job. So that was what I've done over the last 6 years. We've got some things to do, but that's where we're at now. Thank you very much.